My scan of the room. So the patient admitted into room 2 is a 40-year-old male. He is admitted with a viral pneumonia 4 days ago. Initially, he was on oxygen, but that was titrated off on day 3. He has no known allergies and has been taking his bronchodilators regularly. He does have a history of a 10-year smoker, but he's been about 1 year cigarette free. When I enter the room, I will close the door or pull the curtain to ensure privacy, and I will sit down and remain eye level with my patient. Hi, Darcy. My name is Nikki. I'll be your nurse today.
Hi, I'm Darcy Holland, and I give consent to this video.
Darcy, do you mind if I take a peek at your identification bracelet? Perfect. Could you tell me your name and date of birth, please?
Darcy Holland, October 28th, 1985.
Thank you. Now, Darcy, do you know where you are today?
I'm at the hospital.
Okay, and do you know what day it is and time?
Monday at 5 o'clock.
Perfect. Thank you so much. So, Darcy, generally over the last couple of days, have you been feeling?
I feel okay now compared to days before.
Okay, perfect. Have you been experiencing any shortness of breath today on exertion or with activity?
Yes.
Okay, so if you had to rate your shortness of breath on a scale of 0 to 10, 0 being no shortness of breath at all, and 10 being you are unable to breathe, where would you put yourself?
2?
Okay, so a 2 is pretty normal finding for someone recovering from viral pneumonia. Have you experienced a cough with this illness?
Yes.
Okay, would you say it's a productive cough or a dry cough?
Productive.
Okay, how long's the cough been lasting for?
About 5 days.
Okay, and with that productive cough, what color do you notice the sputum being?
Yellow.
Okay, it's a pretty normal finding for someone recovering from a viral pneumonia. Okay, Darcy, do you mind if I start with your vital signs?
Okay.
Perfect. All right, so vital signs look good. Blood pressure is 125 on 75, heart rate is 72, respiratory rate is 16, oxygen is 98% on room air, and temperature is 36.8. Again, those are all pretty normal findings from someone your age. So I am just going to start with a lung assessment. I will note that your chest expansion and your respiratory effort is normal. So I will start by placing my hands on your back on either side of your T9 and T10. I'm just going to get you to take a deep breath in for me. Perfect. And out. So I'm just checking for symmetry of your lung expansion, meaning to see if air entry is going in equally bilaterally, and it is, which is a normal finding. Great. Now, Darcy, I'm going to start by listening to your lungs. That's okay? All right, so I will start listening at the apex of your lung, which is located just at your clavicle here, all right?
Yes.
If you could just breathe normally for me. Perfect. I will locate your sternal notch and I will go about 2 inches below to find your angle of Louis. Now I will listen at the second and third intercostal space, mid-clavicular, and this is where I'm listening to the top of your right and left lower lobe. Sorry, upper lobe. And just breathe normally for me. I will now move to about the fourth intercostal space, mid-clavicular, and this is where I will listen to the middle portion of your right lobe, and then I will continue to listen to the upper portion of your left lobe. We'll now listen to the fifth intercostal space, mid-clavicular, and this is the lower aspect of both of your lobes. We'll now continue to listen at the sixth intercostal space, mid-auxiliary. See, if you can now turn around and I will listen to the posterior aspect of your lungs. Thank you. I will start at C7 to T3 and I will listen on either side of your spine. If you could just breathe normally for me. I will continue down from T3 to T7 and I will listen to the remainder of your lobes. By listening at the 6th intercostal space, mid-auxiliary. You can turn around now. While I was listening to your lungs, I did notice some crackles at the bases of your lower lobes. Again, this is a normal finding for someone who is recovering from a viral pneumonia. So the next assessment I will complete will be a cardiac assessment. I'm going to start by asking if you have any chest pain or discomfort.
No, I do not.
Okay. So I will now listen to your heart. We will start at the 2nd intercostal right of the sternal border. And this is where we will be listening to your aortic valve, also known as S2. Now, if we continue on the 2nd intercostal space, now left of the sternal border, this is where we'll be listening to your pulmonic valve. If we continue the left of the sternal border to the 3rd intercostal space, this is where we'll be listening to Erb's point. If we continue down left of the sternal border to the 4th intercostal space, this is where we would be listening to the tricuspid valve. Last will be the 5th intercostal space, which is the apex of the heart, also known as the mitral valve, and this is where you will hear S1. I'm also going to listen to your heart rhythm and rate. You see, everything sounds good. Your heart rate's at 72 with a regular rhythm, and this is a normal finding for someone of your age. I will now continue with locating and palpating your peripheral pulses. We are going to start at your carotid artery. I will now move to your radial. And your brachial. Thank you. I will now palpate your femoral artery. I will now go down your leg behind your knee to your popliteal artery. I will continue to the inner aspect of your ankle for your tibial artery. Sorry, your tibial pulse. And I will end with your dorsalis pedis. Thank you, Darcy. All your pulses are strong and 2+, which is a normal finding. I will now just check your capillary refill, which is less than 2 seconds, which indicates no central or peripheral cyanosis. I've completed your exam, Darcy. Do you have any questions or concerns you'd like to comment?
I don't.
Okay, perfect. Thank you very much. I will pass along all of my findings to the physician, and he will be in shortly. Thank you.
Thank you.